So my name is Dr. Matt Carroll. I'm the Associate Chief Quality Officer at Cook Children's Hospital and also a pediatric hospitalist. I've been a physician for 8 years now after residency. I enjoy taking care of kids, seeing them come in sick and get them feeling better when they leave. And then also just in terms of quality, I love doing things to promote quality and safety throughout the organization. I think doctors tend to struggle in silence with mental health just because I think we work in a profession that demands perfection, and we see the need for mental health or the need of getting help as somehow some weakness or something that's wrong, and anything that's not up to a perfect standard, I think there's that desire to want to hide and to not let other people see it. I think my view of mental health has definitely evolved over the course of my career and just the course of my life. I think, the perception I had of mental health 10 or 15 years ago, which I think was the completely wrong perception, is that it's somehow a sense of weakness, that it's something you should be able to just get through on your own. If you have a positive outlook, if you tell yourself to be happy, if you smile more, it's something you should be able to deal with on your own. And I think as I've gotten older, just an appreciation of the difficulties and challenges and trials that all of us go through. And I don't think there's anything wrong with admitting that you need help to get through some of that. I think life is tough these days, and especially in our profession, and just being willing to admit that you need help and taking those steps to proactively promote your mental well-being, I don't think is a sense of weakness. I think it's a sense of incredible strength. I think mental health and burnout are all tied together. I think one feeds into the other, and I think it's so easy to get into this vicious circle. The more burned out you get, the more depressed or anxious you get, and that may fuel that burnout even more. And so I think it's all very tightly connected with one another. I think my message for healthcare workers that may be struggling is just an acknowledgement of what we do is hard. The daily grind of what we do day in and day out takes its toll on the best of us. And I think just being open and honest with yourself about how you're feeling and whether or not you need help. And it's more about just taking a proactive steps to promote your own mental well-being. We all exercise, we all eat healthy because we care about our physical well-being, and being as proactive about your mental well-being, I think, is incredibly important for all of us.